Kate Tillow, member of Kentuckians for Single-Payer Healthcare and longtime union healthcare organizer, relates the story of the 2009 U.S. healthcare reform debate. During the healthcare reform debate that led to passage of the Affordable Care Act, Democratic Senator Max Baucus, chairman of the Senate Finance Committee, declared that everything was on the table, except for single-payer health care. When a number of people, including doctors and nurses, rose in the hearing to insist that single-payer health care be considered in the debate, the senator had them arrested. Nevertheless, when confronted with an environmental health disaster in his home state of Montana, Baucus immediately turned to single-payer Medicare. Killing hundreds and sickening thousands in Libby and northwest Montana was a vermiculite mine spreading deadly airborne asbestos, a carcinogen brought home on miners' clothes. The toxic mine waste had been used as soil additives, home insulation, and also spread on running tracks at local schools. Legal avenues to hold mine owner W.R. Grace Company accountable for the environmental and health disaster resulting in massive levels of mesothelioma and asbestosis all failed. The federal government picked up much of the cleanup costs. A 2009 EPA order declared Lincoln County a public health disaster. The Environmental Protection Agency stated, while EPA's cleanup efforts have greatly reduced exposure, past and future exposures of asbestos may remain a public health concern in the area. Senator Baucus immediately added a section, Amendment 1881A, to the Social Security Act as a provision to the Affordable Care Act to cover suffering people of Libby. Not just the former miners, but the whole community. All were covered by Medicare. There were no age limits, no wait times, no qualifying income means tests, no applications for a subsidy, no concern about pre-existing conditions, and no need to find a job providing health coverage. Baucus did not wait for the Congressional Budget Office scoring. He inserted a clause in the Affordable Care Act that permitted special arrangements to enroll all residents of Libby and northwest Montana in national Medicare, demonstrating the possibilities of what can be accomplished when Washington legislators find the political will. Less than 2 months after passage of the Affordable Care Act on March 23, 2010, an office was set up in Libby to enroll everyone in Medicare. There was no competition from the private for-profit Medicare Advantage plans, notes Tillow, because the sick are not profitable. Senator Baucus said of the exclusion for Medicare coverage for Libby residents, "The people of Libby have been poisoned and have been dying for a decade. New residents continue to get sick all the time. Public health tragedies like this could happen in any town in America. We need this type of mechanism to help people when they need it most." By 2017, Max Baucus reversed his earlier stance against Medicare for All, asserting that we've got to start looking at single payer. We should have hearings. It's going to happen. Some in Washington have frankly attempted to destroy Medicare, gradually defunding the program and seeking to move more people to private Medicare Advantage plans. Even some Democrats use the excuse of deficit cutting as a means to reduce Medicare benefits. The political right invokes the bogeyman socialism as a scare word, implying that socialized medicine or social insurance is equivalent to an authoritarian socialist regime. It is not. Medicare is not socialized medicine. It is social insurance. It will pay for private or public providers or hospitals. Military medicine, such as the Veterans Administration, is socialized medicine, in that the health care providers are employed by and paid by the VA. Walter Reed Military Medical Center was good enough for Donald Trump when he needed treatment for COVID-19 virus. Most people would be thrilled to have that level of access to health care. The prescription for Libby, Montana's environmental disaster suggests a roadmap for health care for all in the current COVID-19 emergency that is killing hundreds of thousands and afflicting many with long-term debilitating health consequences. Likewise, any number of cities and towns face their own environmental disasters. Among them, Flint, Michigan's lead-tainted water supply is causing damage to developing children, increased infant mortality, and premature births. It warrants a response like that to Libby, Montana, providing Medicare for all. Parallels suggest that the incoming Biden administration could invoke Section 1881A of the ACA to provide the immediate remedy of Medicare coverage for hundreds of thousands sickened by COVID-19 and other conditions. Under the statute, HHS could create a pilot program specific to COVID-19 or to Flint, Michigan, and unlike the previous requirements for congressional action, the new president could invoke Section 1881A through executive action. It is time for Washington to prioritize improved Medicare for all to meet the needs of all people, instead of rendering people desperate and subject to lack of meaningful health care access. At least 22 studies demonstrate that only a single-payer, improved Medicare for all health insurance model can provide universal health coverage while reining in health costs. This has been Truth Seekers Health Justice, a podcast focusing on human and environmental health and the false corporate narratives surrounding U.S. health insurance reform.
Truth Seekers, produced at Denver Open Media. Music mixed by Tim Johnson.
This is Michelle Swenson.